This video is going to cover oral tablets and capsule calculations. Okay. I always recommend that we start reading the end of the question first, and in this case we are looking for capsules per dose. And then again, stop. What do I need to know to answer this question? Capsules per dose, I need to know my doctor's order and I need to know the concentration on my label. So now I know that this is going to be a D over H times V calculation. You can also use ratio proportion for these questions if you'd like, but D over H times V is one formula that I highly recommend that you memorize and use just because it's a little bit quicker and nurses need to be efficient with their time in the hospital. So I'm going to go ahead and I'm going to look into my information here to find that information. So my D is my doctor's order. What is my doctor's order? My doctor's order is 750 milligrams. So I'm going to write that in there. And then what do I have? Going to my concentration on my label here, I know that I have 250 milligrams times one capsule. Okay, and I'm going to go to my calculator and I'm going to do 750 divided by 250 times 1, and that's going to answer 3. So I'm going to go to my line down here, and I'm going to write 3 caps. Okay, you want to make sure you label your answer. You want to make sure that you write it in the line provided so your instructor knows that that is your final answer. Moving right along, I'm going to read the end of the question first. Milligrams per dose. What do I need to know to answer milligrams per dose? Well, gosh, I don't need my label at all in this question. That is a distractor, so don't even look at the label. Milligrams per dose, I need to see my doctor's order. How many milligrams per dose? There is no math right here. It's 80 milligrams. That is my answer. So make sure reading this question first, what do I need to know, so you don't automatically start calculating how many tabs or milliliters you need, only milligrams per dose. So stay on target, stay focused, and save your time. Okay, next question. Tabs per dose. All right, what do I need to know to answer that question? I need to know my doctor's order and I need to know the concentration on my label. So this is going to be a D over H times V question. So my D, my doctor's order, 600 milligrams. And what do I have? I have 300 milligrams times one tablet. So I'm going to do that math. I'm going to go to my calculator. 600 divided by 300 equals 2. 2 what? 2 tabs. I'm going to write it right in here on the line. I'm going to make sure I label that. Okay, moving right along. End of the question first. Milligrams per dose. What do I need to know? Again, I don't care about my label. All I care about is my doctor's order right here. My doctor's order is 400 milligrams per dose. My answer is 400 milligrams. And I'm so happy because I caught that. And I know that's an easy question and I know I got it right. Okay, scrolling right along. Gels per day. Okay, that's a little tricky here. Per day is not normal. Usually they ask per dose, but in this case it's per day. So I'm going to go in here and I'm going to write gels per day, just to help me keep in track of what I'm actually looking for here. So what do I need to know? I need to know how many gels per dose, and I'm going to need my doctor's order and my label, and then I also need to know how many doses per day. And I know that TID equals 3 doses per day. So I know that how many gels, I'm going to get how many gels per dose times 3 doses per day is going to be my answer. So I'm going to start this with a D over H times V. So there's multiple steps here. And just to remind myself it's multiple steps. That's why I wrote this in here to start, just as a reminder. You do not have to necessarily put per day in your answer on your MAPE, but I put that in there as a reminder for myself because I know I'm not looking per dose. Okay, so my doctor's order is 650 milligrams. What do I have? I have, a little hard to see my pen here, I have 325 milligrams times 1 gel. So I'm going to go to my calculator. 650 divided by 325 equals 2. Is that my answer? No, it is not my answer. I'm going to give 2 gels per dose. And if I'm giving 2 gels per dose and I'm giving 3 doses per day, 2 times 3 equals 6. I'm going to be giving 6 gels per day. 6 per day. Okay, moving right along. Doses per day. What do I need to know to answer that? I don't need this, do I? Doses per day. This is the part of the doctor's order. I want to know how many times I'm giving this medication. So if I'm giving it every 12 hours, I'm giving 2 doses per day. Final answer. And again, I'm super stoked that I got that one right. Pretty sure about that. Okay, scrolling right along. Tablets per dose. What do I need to know? I need to know my doctor's order. I need to know the drug concentration on my label. This is going to be a D over H times V question. So what's my D? My doctor's order is 5 milligrams. What do I have? I have 10 milligrams times 1 tablet. I'm going to do that math. I'm going to do 5 divided by 10 and times 1, and I get 0.5. 0.5 what? Tabs. And I'm going to write that 0 in there because we want to mark that, because if I just wrote 0.5, that decimal might get lost, okay? But I would never write a trailing 0 because that could look like 50. So when you write these numbers, you want to put a 0 in front of the decimal, but we do not add zeros at the end of our number, okay? So the answer is 0.5 tabs. Okay, how many doses per day? Doses per day. Oh, yay, I don't need that again. Doses per day. This question is asking me if I know what TID means. And TID means 3 times a day. So I am going to write 3 doses per day. And again, woohoo, I am so happy. Okay, moving right along. How many tabs per dose? D over H times V. I'm going to need to know what my doctor ordered, and I need to know what the concentration is in my medication. So what's my doctor's order? It is 324 milligrams. And what do I have? I have 81 milligrams times 1 tablet. Go to my calculator. 324 divided by 81. That equals 4 tabs per dose. I'm going to write 4 tabs. Final answer. Okay. Caps per dose. Caps per dose. I need my doctor's order. I need my drug concentration. These are things that you have to think about before you go in, so you don't look at all that information that you may not need. I know this is going to be a D over H times V calculation. So my D, my doctor's order, 500 milligrams. And then what do I have? I have 200 milligrams in 1 capsule. So I'm going to go to my calculator. 500 divided by 200 equals 2.5. My answer is 2.5 caps. Final answer. Milliequivalents per day. Oh boy. So I'm going to notice right here, it's not per dose, it's per day. So what do I need to know that? Well, I need to know how many equivalents per dose, and then I need to know how many doses per day. Okay, those are 2 things I need to know. So my milliequivalents per dose is 40. I'm giving 40 milliequivalents per dose. And how many doses per day am I giving? BID. I know that means 2 times a day. 2 doses per day. So how many milliequivalents per day? It's going to be 40 times 2. So I'm going to be giving 80 milliequivalents per day. Okay. Again, capsules per dose. What do I need to know? Stop and think. I need to know what my doctor's order is, And then I need to know the concentration of my label. So I know that this is a D over H times V calculation. My doctor's order is 80 milligrams. What do I have? I have 40 milligrams times 1 capsule. Go to my calculator. 80 divided by 40 equals 2. What's my answer? 2 caps. Milligrams per day. Okay, milligrams per day. So I'm going to stay focused on this. What do I need to know to answer that? Well, I need to know how many milligrams per dose, and then I need to know how many doses per day. So I'm going to look up here and I see that I'm giving 750 milligrams per dose. How many doses per day? TID. I know that means I'm giving it 3 times a day. 3 doses a day. So my math here is going to be 750 times 3. I go to my calculator, 750 times 3, and that's going to equal 2250. 2250 what? Milligrams per day. Make sure you label that, write it over the line. Almost there. How many milligrams per dose? Yay, it's another one I'm going to celebrate. How many milligrams per dose? What do I need to know? All I need to know is my doctor's order. And it's right here, 600 milligrams. 600 milligrams. Okay. Because I'm still happy. Okay. Scrolling through. Capsules per dose. I need to know my doctor's order. I need to know my drug label. This is going to be a D over H times V calculation. What is my D? My doctor's order. 600 milligrams. What do I have? I have 300 milligrams times 1 capsule. Go to my calculator. 600 divided by 300 equals 2. My answer, 2 caps. Final answer. The last one. Okay, doses max could the patient receive per day? Okay, so this is a little bit of a tricky one. I want to keep track of this a little bit. So this medication is given PRN, which as you know means whenever necessary. Give it for pain or fever, whatever the reason is, whenever we need to give it. So PRN, if it's saying doses max, because sometimes we can only give a certain amount of medication total per day. So if this patient were to have this medication every 8 hours because they needed it, how many times per day could they get it? That would be 3 times per day. If they had it every 8 hours, they would have it 3 times a day. And this isn't asking me how many milligrams, this is asking how many doses the patients could get. So my answer is 3 doses per day max. Okay. And that's the end of this video. So if you're having trouble, if this is confusing to you, please reach out, send me a message. I'm always happy to meet with you guys. I love doing math. Hope you have a great day. Bye-bye.